Hello everyone, I am Dr. Aditya Sai. Welcome to our channel. So today we are going to talk about hip pain in young individuals. So hip pain represents different problems in different age groups. In somebody who is 8 to 14 years, it can represent something else. Somebody between the age of 14 to 40, it means something else, and above 45, it totally means something else. So hip pain is a very common problem, and at different age groups it can mean different things. So for the sake of brevity, we'll stick to hip pain in the individuals between the age of 14 to 40. So before we delve into that, let's have a look at the hip joint. It's a ball and socket joint. There is a lining around the joint known as a capsule. So essentially it's a condensation of various ligaments. Around the socket, which is called the acetabulum, there is a tissue known as labrum, which increases the depth and provides a watertight seal for the joint. The upper end of the thigh bone or the femur forms the ball, which is known as the femoral height. So hip joint problems in younger individuals typically are seen in athletes who are involved in repetitive extremes of movement of the hip joint, like gymnasts, football goalkeepers, wicket keepers, who are repeatedly squatting down, getting up, squatting down, getting up. So their hip is subject to extremes of movement. So that can lead to tears of this tissue which is just discussed, which is known as the labrum. Typically it can present with pain in the groin and restriction of movement. Individuals can have difficulty in walking or for that matter jogging. The most important thing which we need to understand is hip is not a very painful joint. So in early stages of the disease, symptoms are always very minimal. It's only once the disease reaches the end part, that time you start getting significant pain in the hip joint. So it's always wise to not ignore any hip pain and get it diagnosed and treated early. When we talk about this, labral tears, which are common in this age group, initially the pain can be managed with physiotherapy, activity modification. But if somebody is an athlete who desires to play, who has to do wicket keeping, or who has to do goalkeeping, or for that matter gymnast, then there are surgical procedures. So these are keyhole surgeries or arthroscopic procedures which are done through very small cuts around your hip joint about the size of your fingernails. So we insert our instruments inside the hip joint, we visualize the damaged pathology, and then we repair it. This is known as an arthroscopic labral repair. This has got very good results and it's not a very painful surgery. Typically the next day you can start moving around. For the first 4 to 6 weeks, weight bearing on the hip is restricted. Then after that, swimming can be started. You can start with your gym. And if you want to squat down, or if you want to run, jog, or for that matter play any sports, by 4 months it can be resumed. So it gives very good pain relief and excellent long-term results. The other pathology which is common in this age group is femoroacetabular impingement. So what is impingement firstly? Impingement is the contact between two structures and it can lead to pain. So impingement in the hip can happen due to two reasons. Either the ball is misshapen or the socket is misshapen. So in case the ball is misshapen, it is known as a cam impingement. Typically, again, it is seen in younger athletes who are involved in extremes of movement during sports. Their hip bone remodels in such a way to give them more mobility. Unfortunately, it can lead to impingement. The other pathology is a pincer impingement, whereas the acetabulum or the socket, there is an overgrowth of the socket which can lead to impingement on the ball. This is typically seen in women above the age of 35. It can again lead to cartilage and labrum tears. Treatment for both problems is simple, straightforward, is with an arthroscopic procedure where the bony prominences are removed and the labrum tissue is repaired. All these surgeries are keyhole surgeries. They are joint preserving surgeries which will enhance your mobility and your quality of life. As I said before, a lot of these problems don't cause a lot of pain initially. You will always be able to manage, but you will never be 100% with these problems. Only once these problems progress further, that time you start getting significant pain. Unfortunately, a lot of times once that happens, we cannot repair these tears because by that time arthritis has already set in the hip joint. So if we do hip arthroscopy in presence of arthritis, generally the results are not so good. So that's why, again, as I said, it's important to diagnose hip problems early, get them treated so that you can have a pain-free hip joint and exercise to the best of your potential. So this is it for today, and if you like our channel, share and subscribe.